Honorable Ministers, good morning and good afternoon, distinguished representative, ladies and gentlemen. First, to remind you that the special session drafting group is meeting in the MNST room 5 now. I have a great pleasure in declaring the 73rd session of the World Health Organization Regional Committee for Western Pacific open. Distinguished representative, for the past 2 years, we have different setup for the sessions of regional committee. We met virtually in 2020. Last year was the first time we met in a hybrid arrangement. And this year, we meet again in a hybrid format. Although it is wonderful to be among so many more delegates today. Because the meeting is again in hybrid format, we need to adopt special procedures to regulate the conduct of the meeting. Draft special procedures were prepared by the Secretariat and circulated to member states for considerations and comments, together with the note verbal dated 27 June this year. A revised version of the draft special procedures was circulated on the 16th October for considerations by member states. During the period for considerations of the revised draft special procedures, one member state provided comments. I would like to give the floor to the legal office to address this matter.
Thank you, Chair. Thank you, Chair. One member state provided comments on the provision that would allow a secret ballot to be conducted in person only among the member states that are physically present. Paragraph 16 of the revised draft special procedures that were circulated on the 16th of October indeed provides that in the event that a secret ballot is needed, the vote shall be conducted in person among the member states that are physically present for the purposes of the session. To address the comment received, the Regional Committee may wish to amend this provision in the draft special procedure to allow for secret ballot only if all the member states are physically present at the session. Accordingly, paragraph 16 could be amended to read as follows. No decision shall be taken by secret ballot unless a member of the delegation of each member of the Regional Committee entitled to vote is physically present at the session. As a consequential amendment, paragraph 3 of the revised special procedures would also have to be modified. The sentence, I quote, except for the purposes of a secret ballot, in which case the presence of a quorum shall be calculated in accordance with paragraph 16 below, would be deleted. I would like to make clear that as not all the member states are currently physically present at this session of the Regional Committee, the result of this change would be that secret ballot will not be an available means of decision-making for the 73rd session of the Regional Committee. In accordance with well-established practice, the expectation is that decisions, if any, would be taken by consensus. However, voting by show of hands and roll call would still be available if needed. Thank you.
Thank you, Claudia. May I take it is that Regional Committee is content to adopt the special procedures as amended. If there is no objection, it is so decided. Honorable delegates, next I would like to report to you on the credentials for the meeting. It is my pleasure to report to the Regional Committee that credentials were received for 33 members and areas. In accordance with the special procedures we have just adopted, I examined these credentials and found them to be incompatible with the rules and procedures of the regional committee. I therefore propose that the committee recognize their validity. If there is no objection, it is so decided. Finally, before we proceed with our agenda, it is necessary to acknowledge that the session of regional committee is taking place in extraordinary circumstances. The absence of the regional director is very much felt. I would like to thank you, the Deputy Director General, for acting as office in charge of the regional office for the last several weeks. With the permission of the committee, I would like to ask her to act as secretary to the 73rd session of the committee, supported by secretaries more generally. It is acceptable to the regional committee? I see no objection. It is so decided. Thank you. We will now move to the next agenda. Honorable Ministers, distinguished representatives, Dr. Tedros, WHO Director General, Dr. Susan Jacob, the Deputy Director, 6,550,000 people have died. In the region, this figure is around 275,000. This year, we have also faced the new threats of monkeypox. But thank you for the hard work of the countries, WHO, and other key partners across the region. Vaccination coverage in the region is high. And so many of us can be together in person this week. Despite all the challenges, we have been able to make strong progress on the other major agenda items we agreed on last year. These were primary health, school health, traditional and complementary medicine, and tuberculosis. I take this opportunity to share updates with you on each of these items. This time last year, we had a panel discussions on primary health care, during which regional committee reflected on the needs for reform to strengthen public health care and prepare countries for future health challenges. Since the panel discussions, the Secretary has conducted consultations with member states, experts, and partners in the region to develop the draft regional framework, which will be reviewed by the regional committee. WHO and partners have also continued to work with countries to develop and implement new approaches to public health care tailored to their context. Last year, the regional committee also endorsed the regional framework on nurturing resilience and help future generations in the Western Pacific, which aim at placing schools at a hub in the communities, linking local health systems and existing community networks to provide knowledge sharing and life skills teaching that will be benefit both the children and community themselves and members. Over the last year, WIPRO has worked with member states to implement the framework, with a particular focus on reviewing existing school health policies and their implementation and delivery tailored support based on country needs. In addition, WHO has been working with the key partners and member states to share good practices across the countries. Another regional framework endorsed last year was the regional framework for harnessing traditional and complementary medicines for achieving health and well-being in the Western Pacific, which articulates the contributions of traditional and complementary medicine to achieving the well-being and health of population in the region. Over the last year, WHO has worked with member states and partners to promote the role of traditional and complementary medicines for health and well-being through updating national policies to strengthen mechanisms to ensure the safety, quality, and effectiveness of traditional and complementary medicine products and services, and to increase coverage and equitable access to safe and effective these services. Lastly, the Regional Committee endorsed the Western Pacific Regional Framework to end the TB 2021-2030. Despite good progress, TB remains a major public health problem in the region, which about 1.8 million people developing TB and over 90,000 dying annually. The framework is based on the system approach and addresses social economic risk factors through multi-sectoral engagement. It revisits challenges and action in four layers. TB-specific challenges in health system that influence TB care. Challenges in sectors beyond health that determine TB. And overarching governance issues, multi-sectoral action and accountability are embedded in the framework. The regional framework has been disseminated through various platforms, and countries are now translating it to their local context. They are working hard to catch up after a massive drop in case detection due to the pandemic. There is also progress in social protection and multi-sectoral engagement, including through a regional-wide assessment. All this setup holds ground for coming years' agenda, as we will hear more about from the incoming chair tomorrow. Let me end here by thanking last year office bearer for their wonderful support, and the WHO Secretary for all your efforts to prepare for the meeting, and of course, for your support to the country over the years. Thank you very much. Honorable Ministers, we are now coming to the election of the chairperson. We now consider the next item, the election of the new officer, beginning with the chairperson. Are there any nominations for the office of the chairperson? New Zealand, you have the floor.
Chairman, I nominate Lao People's Democratic Republic to be elected for the post of chairperson.
Malaysia,
Democratic Republic for the post of the chairperson of the 73rd session of the WHO Regional Committee for the Western Pacific. Thank you.
thank you. The representative of Malaysia has seconded the representative of Laos Democratic Republic for the office of the chairperson. Are there any nominations? If there is none, I have a great pleasure in pronouncing the representative of Lao People of Democratic Republic, the Honorable Bufei Formalaisa, the Minister of Health, as the chair. Will the Honorable Minister for Malaysia please take the chair? The Honorable Minister of Lao PDR, please take the chair. I thank you again, the other officer of the last session, and wish the new chair a very best for this meeting. Thank you.
Congratulations. Thank you, Minister. Thank you for your service.
Thank you, Honorable Minister, distinguished representatives. I thank you all for electing me as a chairperson of the 73rd session of the Regional Committee for the Western Pacific. I would like to ask your indulgence in allowing me to postpone my address to the committee until tomorrow morning. We now proceed with the election of the vice chairperson. Distinguished representative, are there any nominations for the office of vice chairperson? Korea, please, the floor is yours.
To be elected for the post of vice chairperson.
Thank you. The representative of Korea has nominated the representative of Tonga for the office of vice chairperson. Are there any seconders?
Thank you, Chairman.
Samoa?
Samoa seconds the motions for the nomination of Tonga as vice chair. Thank you.
Thank you. The representative of Samoa has seconded the nomination of representative of Tonga for the office of vice chairperson. Are there any other nominations? There being none, I have much pleasure in pronouncing the Honorable Sir Pikala, Minister of Health of Tonga, as the vice chairperson. We now come to the nomination of our rapporteur. May I ask first for nomination of the office of rapporteur for the English language? Singapore.
Thank you, Chair. I nominate Australia to be elected for the post of English Rapporteur.
Thank you. Representative of Singapore has nominated a representative of Australia as the English rapporteur. Are there any seconders? Micronesia, please.
FSM seconds the nomination for Australia to be elected for the post of English Rapporteur.
Thank you, the representative of Micronesia has seconded the nomination of representative of Australia for English Rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Miss Alois Scott from Australia as the English Rapporteur. May I now ask for nomination for the office of Rapporteur for the French language? The Philippines, the floor is yours.
Chair, I nominate France to be elected for the post of French Rapporteur. Thank you.
Thank you, Representative. Has nominated a representative of France as a French Rapporteur. Are there any seconders? Chairperson, the floor is yours.
Thank you, Chair. I second the plans to the elected for the post of French Rapporteur. Thank you.
Thank you. The representative has seconded the nomination of representative of France for French Rapporteur. Are there any other nominations? There being none, I have much pleasure in pronouncing Miss Ine Ferrer from France as a French Rapporteur. Thank you very much. Congratulations to my fellow office bearers, and I look forward to working with you on to ensure a smooth and efficient meeting this week. With that, we will move to the next agenda item. Distinguished representatives, document WPR/RC73/1 contain the provisional agenda. Are there any comments? If there are no comments, we can proceed. In the absence of comments, the agenda is adopted. It is my pleasure to now invite the Deputy Director General and Vipro Officer in charge to say a few words. Dr. Jacob, the floor is yours.
Thank you very much, Mr. Chair, Honorable Ministers, Director General, distinguished delegates. Welcome to the 73rd session of the Regional Committee meeting for the Western Pacific region. We are so pleased to be able to welcome you back to Manila after so long. The last couple of Regional Committee meetings have been unique. From our first ever completely virtual Regional Committee meeting in 2020 to last year's first hybrid meeting in Himeji City, Japan. It is great to finally be able to welcome more of you here in Manila. But we are so pleased to continue to be able to expand access to the meeting by maintaining the hybrid format. It is a pleasure to have many of you here this week, both in the room and also online. This is going to be a great Regional Committee meeting. The Western Pacific region has made impressive progress in so many areas of health, from COVID-19 to the elimination of diseases like trachoma and lymphatic filariasis and many others in several countries and areas. But of course, there is much more to be done. In 2019, this region adopted the vision for the future, a shared vision of how to make this the healthiest and the safest region. This week, we are meeting to discuss important items such as cervical cancer, non-communicable diseases, prevention and control, mental health, primary health care, and reaching the unreached. These topics are key to driving forward the priorities that have been so well laid out in the vision for the future. I have only been here for a short while, but I have been so impressed to see the work and consideration that has gone into each and every item. I thank you all for your contributions and look forward to our discussions and to a great regional committee. Thank you, Chair. Back to you.
Now I would like to invite the Secretariat to provide a short briefing on how we reorganize our work this week. May I now call the Director of Program Management, Dr. Corinne Capuano. Dr. Capuano, over to you.
Thank you very much, Mr. Chair. Good morning, good afternoon, honorable ministers and distinguished delegates. May I get the presentation on the screen, please? First, on the meeting times, next one, please, yes. All the times I will be mentioning are in local time in Manila. The working hours of the session meetings are from 9 a.m. to 5 p.m. There will be coffee break from 10:15 to 10:30 in the morning and 3:15 to 3:30 in the afternoon. Lunch is from 12 noon to 2 p.m. On Tuesday, Wednesday, and Thursday, we'll have 1 hour side event from 12:45 to 1:45. Next one. Yeah, thank you. Regarding the management of agenda items, under item 6, the Director General will address the Regional Committee. It will be immediately followed by item 7. For item 7, the Regional Director's report will be presented by the Secretariat as a team. It will include a brief update on COVID-19. We request that Member States combine their intervention on this item with those for item 6. If Member States wish to intervene on COVID-19, please do so as part of your combined interventions on items 6 and 7. For item 8, program budget, item 8.3, program budget 2024 to 2025 includes the extension of GPW 13. Sub-items 8.1, 8.2, and 8.3 will be taken together, so we request that Member States combine their intervention on these 3 sub-items. For item 9, panel discussion on communication for health, this item will start at 2 p.m. on Tuesday, irrespective of progress on the rest of the agenda. There are 5 technical items with regional action frameworks for consideration by the Regional Committee. These items will be taken in the following order: non-communicable disease prevention and control, primary health care, reaching the unreached, cervical cancer, and mental health. For item 16, coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee, this item will be taken in 3 parts. Item 16.2, WHO's work in country, will start at a fixed time of 9 a.m. on Wednesday, 26 October, irrespective of progress on the rest of the agenda. Item 16.5, other items, will start at a fixed time of 2 p.m. on Thursday, 27 October, irrespective of progress on the rest of the agenda. South Africa, which serves as the Intergovernmental Negotiating Body co-chair, and Japan, the Western Pacific region's representative on the INB Bureau, will provide an update on the INB's work and request input from Member States. Member states will be invited to make their interventions following this update. The remainder of item 16 will be handled later in the week with separate intervention on 16.1 agenda for the 74th session of the Regional Committee in 2023, 16.3 WHO reform, in which the Secretariat will provide an update on the work on workplace culture and organizational change. For sub-item 16.4, items recommended by the World Health Assembly and the Executive Board, Member States will be asked to provide written comments only. Moving to Friday, we will have item 15, progress report on technical programs. Delegates are kindly requested to combine their intervention on the progress report. The remaining items 17, 18, and 19 will be handled in the usual manner with a brief introduction from the Secretariat, followed by Member State intervention. If additional time is needed to complete discussions, session hours may be extended until 6 p.m. on Tuesday and/or Thursday. Rapporteur meetings would then occur immediately following the extended session on those days, if necessary. Regarding the side events, from Tuesday to Thursday, there will be lunchtime side event on financing UHC, antimicrobial resistance, and innovation. Finally, a few remarks on some practical matters. Member states are kindly requested to limit their intervention to 3 minutes. A timer will show on the screen. If you are sending in or reading an intervention, 3 minutes means less than 300 words. When you wish to address the session from the plenary here in Manila, kindly press the small button on your microphone and wait until the small light turns green to start speaking. For those joining virtually, kindly press the raise hand icon in the lower part of your screen. Your request to speak will be listed in the queue. The chair will alternate in calling on delegates here in the room and those joining virtually. May I take this opportunity to remind distinguished representatives that the written copies of your interventions can be extremely helpful for report writers to capture your important comments. So please send them along to the RCM mailbox, which appear on the screen. Draft resolutions will be made available at the RC73 SharePoint portal as of tomorrow morning. These are prepared before the start of the Regional Committee to facilitate the committee's work. Of course, revision can be made to reflect the discussion on the specific agenda item. Whenever possible, please send any suggestions on the draft resolution to the Secretariat through the RCM mailbox before 3:30 p.m. on the day of the discussion of that item to ensure that rapporteurs will be able to consider your suggestions when they review the resolution in the rapporteurs' meeting. Also, rapporteurs usually appreciate when specific wording is provided, as in specific wording desired in your recommendations. Lastly, Mr. Chair, I have been asked to advise delegates that even in this hybrid arrangement, we hope to be able to continue with the Western Pacific region tradition of making the Regional Committee a healthy meeting, including mobility breaks throughout the session. We are looking forward to see delegates participate in these. Thank you very much, Mr. Chair.
Thank you very much, Dr. Capuano. As Dr. Capuano mentioned, we ask all honorable delegates to keep your intervention concise this week. As we do have a very busy program, I look forward to working with all of you to get through our very busy agenda. There is one other important issue I would like to briefly mention as the chair of the RCM. As you are all aware, WHO is committed to enabling events at which everyone can participate in an inclusive, respectful, and safe environment. The WHO has a policy on zero tolerance for sexual misconduct, including sexual harassment in any form, including sexual harassment harassment in any form, including because of gender identity, race, religion, or belief, or nationality, and sexual harassment is prohibited at WHO events. Any participant who has concern is strongly encouraged to report to the matter to the Secretariat. I would like to ask you a couple of things. In line with the risk management approach for this meeting, please keep your mask on when speaking. Please also speak slowly and clearly into the microphone. It is very important for the interpreter. We now move to the next agenda item. Distinguished representative, ladies and gentlemen, it is now my great pleasure to invite our Director General, Dr. Tedros, to deliver the Director General address. Dr. Tedros, the floor is yours.
Honorable Isaiah Vaipuna Tape, Minister of Health of Tuvalu and Vice Chair of the 7th Regional Committee, outgoing Chair, and the incoming Chair, Honorable Bun Feng Pomalayasit, Minister of Health, Lao, People's Democratic Republic, Honorable Ministers, and heads of delegation, excellencies, dear colleagues and friends. Good afternoon to all of you. It's a real pleasure to be back in Manila, to be able to meet face to face once again. As I said at the special session this morning, I know this has been a difficult time for member states and the staff of the regional office. I thank Deputy Director General, Dr. Susanna Jacob, for her leadership as officer in charge, and the staff of the regional office for continuing to take forward the work of the region during this difficult period. When I addressed you virtually last year, I said that I hoped it would be possible to meet face to face this year. And here we are. The fact that we're once again able to meet in person is testament to how far you have all come in the fight against COVID-19. It's pleasing to see that reported cases and deaths in the region are now declining after several member states experienced surges this year. As a region, you have demonstrated great resilience in the face of this pandemic. The muscle memory you gained from your experience with SARS, MERS, H5N1, H1N1, and other outbreaks has helped many member states in this region to prepare and respond well. It's very pleasing to see that more than 80% of older people in the region are now fully vaccinated, the highest rate of any region in the world. As I have said, over the past few weeks, we have never been in a better position to end COVID-19 pandemic as a global health emergency. After more than 2.5 years in a long, dark tunnel, we're just beginning to glimpse the light at the end. But we're not at the end yet. We are still in the tunnel. And there are many obstacles that can trip us up if we don't tread carefully. We continue to urge all member states to prioritize the vaccination of all health workers and all older people on the way to achieving the target of 70% coverage in all countries. Likewise, we urge all member states to expand access to life-saving antivirals and to increase surveillance, testing, and sequencing to enable us to understand how this virus is evolving. WHO has recently published a set of 6 short policy briefs, which outline the essential actions all countries can take to reduce transmission and save lives. We urge you to use these briefs to reassess and readjust your policies to protect those most at risk, treat those who need it, and save lives. The pandemic is always evolving, and so must the response in every country. And even as we continue to respond to COVID-19, we must maintain momentum on building a stronger architecture for health emergencies. As you know, member states are now negotiating a new legally binding international instrument on pandemic prevention, preparedness, and response. I'm glad to see Colin has been chairing the working group for a long time. He must be tired now. I urge member states of this region to engage actively in these negotiations. It's in your own interests to make sure that the final instrument reflects your circumstances and needs as individual member states and as a region. This instrument is a vital part of the new health emergency architecture, but by no means the only part. A new financial intermediary fund for pandemic prevention, preparedness, and response has now been established at the World Bank, with WHO providing technical leadership, chairing the technical advisory panel. We urge all member states to invest in the fund to support catalytic and gap-filling financing to implement the core capacities of the international health regulations. Meanwhile, a new peer review mechanism to evaluate country preparedness is now being piloted, the Universal Health and Preparedness Review. So far, no member states from this region are participating in the pilot phase, and I encourage you to do so. Would be happy if a few of you could apply actually today, and I will have something to take back to Geneva. Excellencies, heads of delegation, I thank you all for putting your trust in me to serve you as Director General for another 5 years. At the World Health Assembly in May, I outlined 5 priorities for the next 5 years as we work together to recover from the setbacks of the pandemic and drive progress towards the triple billion targets and the sustainable development goals. Promoting health, providing health, protecting health, powering health, and performing for health, the 5 Ps. It's important to underline that these 5 Ps do not replace the 13th general program of work for the triple billion targets. They are more about how together we will reach those targets, which are part of the Sustainable Development Goals. The 5 priorities have much synergy with your agenda this week and with the For the Future vision for the region. Allow me to discuss each one briefly. First, promoting health. Realizing our vision for the highest attainable standard of health starts not in the clinic or the hospital, but in schools, streets, supermarkets, households, and cities, and especially in our homes. Pacific Island ministers were exactly saying the same thing. How can we help our kids be healthy? And that starts from schools. But what we do in school can also get into our homes, into the family, which is true. Much of the work that you do as ministers of health is dealing with the consequences of unhealthy diets, polluted environments, unsafe roads and workplaces, inadequate health literacy, and the aggressive marketing of products that harm health. That's why we're calling on all member states to make an urgent paradigm shift towards promoting health and well-being and preventing disease by addressing its root cause and creating the conditions for health to thrive. That should be the way. The regional action framework on non-communicable diseases that you are considering this week can only succeed if member states address the risk factors that drive the incidence and prevalence of NCDs. That includes the climate crisis fueled by our addiction to fossil fuels, which is making weather-related disasters more frequent and more extreme, and threatening the very existence of many small island states in the Pacific. You know, when I visited Tuvalu in 2019, I met a young boy, 13 years old, and he told me that with his friends, they discussed about the fate of their island. And their discussion is, if Tuvalu sinks, what do we do? And then some of them say we sink with Tuvalu. Others say, no, we migrate to Fiji or whatever. I was really, really sad. Children should be children. Imagine children discussing about this, and you know, this is a nightmare, not knowing even what to do. But since this is a serious issue for Tuvalu and for other related islands, they're in that trap of discussion, and they express their feelings to like others. But for them, that age is to play, to have fun, to learn. It's not really to worry about sinking with an island. But I hope it won't, and these kids will live in a country they belong to. But the world should be serious for that to happen. And from WHO side, we will do our best and we will work with you closely. The second priority is providing health by reorienting health systems towards primary health care as the foundation of universal health coverage. We know that 90% of essential health services can be delivered at the primary health care level. I'm heartened to see that this week you're considering regional action frameworks for primary health care, cervical cancer, mental health, and reaching the unreached. After all, it's not universal health coverage if it's not universal. The third priority is protecting health by strengthening the global architecture for health emergency preparedness response and resilience. The COVID-19 pandemic has exposed significant vulnerabilities in the world's defenses against epidemics and pandemics. In May, the Secretariat published a white paper with 10 key proposals for stronger governance, strong financing, and stronger systems and tools for global health security. Several of these proposals are already being acted on, as I described earlier. The fourth priority is powering health by harnessing science, research, innovation, data, and digital technologies. Advances in science and research are constantly pushing back the boundaries of the unknown and the impossible, increasing our understanding and opening new possibilities. Innovations in health products and service delivery give us hope of overcoming challenges that once seemed insurmountable. Developments in big data and machine learning are helping us to see who is being left behind, where the biggest gaps are, and to track progress against our targets. And digital technologies offer huge potential for delivering health services in new ways to more people, especially in hard-to-reach areas. To pick up the pace towards the 3 billion targets and the Sustainable Development Goals, we must pick up the pace and the scale at which science, research, innovations, and digital technologies are adapted and implemented. Finally, the fifth priority is performing and partnering for health by building a stronger WHO that delivers results and is reinforced to play its leading role. The pandemic has demonstrated not only why the world needs WHO, but why the world needs a stronger, empowered, and sustainably financed WHO. I thank all member states for the historic commitment you made at this year's World Health Assembly to gradually increase assessed contributions to 50% of the base budget over the next decade. This will give us independence. This will help us to focus on major priorities. This commitment will transform the Secretariat's ability to deliver results where it matters most in the lives of the people we all serve. Maintaining momentum is vital, though, and the first step toward sustainability comes with the proposed 20% increase on assessed contributions in the 2024-25 budget. As you know, Even before the pandemic, we had already made major improvements in effectiveness and efficiency as part of our transformation. Building on the lessons of the pandemic, we're committed to continuing that journey and to making WHO even more effective and efficient. In particular, our focus in the coming years is to significantly strengthen our country offices to support greater country capacity and greater country ownership, especially by strengthening the health workforce of every member state. The WHO Academy will play a vital role in achieving that. Excellencies, colleagues and friends, your agenda this week reflects the wide range of challenges you face as a region. I give you my commitment that your WHO will continue to support you through our country and regional offices and at headquarters to promote, provide, protect, power, and perform health. One of the reasons I like coming to the WIPRO Regional Committee meeting is that every time I come, I get to celebrate another country eliminating another disease. The first time I came to the regional committee in 2017, I had the honor of celebrating the elimination of trachoma in Cambodia and the Lao People's Democratic Republic. In 2018, I was here once again to confirm Palau, Vietnam, Wallis, and Futuna for the elimination of lymphatic filariasis. Today, I'm lucky, another one. I'm delighted to be back to congratulate Vanuatu on becoming the first country in the Pacific to eliminate trachoma. In fact, this is the second neglected tropical disease Vanuatu has eliminated after lymphatic filariasis in 2016. So well done, Vanuatu. Diseases don't eliminate themselves. Eliminating a disease from an archipelago of 83 islands is an outstanding achievement that has only been possible thanks to the determination of the government, with support from WHO and many other partners. Vanuatu's success underscores the comprehensive nature of WHO's safe strategy for trachoma elimination. Surgery, antibiotics, facial cleanliness, and environmental improvement. We urge other member states in the region that struggle with trachoma to follow Vanuatu's example in adopting the safe strategy. Thank you all once again to all member states for your continued commitment to serving your people and working for a healthier, safer, fairer world. I thank you. Thank you very much. Salama.
Thank you very much, Dr. Tedros. As you heard during Dr. Tedros' address, Vanuatu is being recognized today for its efforts in eliminating trachoma as a public health concern. Congratulations, Vanuatu. May I now call on the chief delegate to join Dr. Tedros at the front for a brief presentation, please. Before we break for the coffee for the day, we need to take a group photo. And then the plenary session will reconvene in 20 minutes, in 3:45. So I now call on the regional communication manager to provide the detail of the group photo. Please.
Thank you so much, Chair. Good afternoon, delegates. It's now time to take the official photographs of the 73rd session of the Regional Committee. So we're going to do this in two parts. Delegates who are participating virtually, we kindly ask you to stay online for a few minutes, get ready to turn on your cameras, and when the time comes, of course, smile and wave so that we get a good screenshot. And we'll do that in a few minutes after I've given the instructions to those of us who are in person here in Manila. So thank you in advance for your patience. Delegates who are here in Manila in this room, in a moment, we're going to ask you to move to the location for the photograph of all of the in-person delegates this year. That's going to be the driveway at the front of the hotel where you came in this morning. So we'll do the first photo, as always, of the chief representatives or their alternates who are participating here in person, along with DG, DDG, DPM at the front of the picture. When we've got that first photo, then we'll ask all of the other delegates and members of the Secretariat to slot in behind those people who were at the front of the photo in the first picture. So we'd now like to ask you to move as soon as you can, please, to the location of the photo, that driveway at the front of the hotel, where we'll get those two pictures done as quickly as we can, so that you can grab a cup of coffee and be back here on time for a prompt resumption of the session. Thanks. May we ask everyone online to please turn their cameras on and give us a wave, please. We're going to be taking some screenshots. It'd be great to see a few more cameras on if possible, please, delegates. Someone else is on. Hi there. Thank you so much. Thanks for waiting. We're now ready to take the photo. So could I get a big smile and a wave from everyone who's online, please? We'll get a couple of screenshots of you all. Yep, keep waving. If anyone else hasn't got their screen on yet and can put it on and wave, that would be excellent. Keep waving. Keep waving. Great to see a few extra screens on. Hi, Travis. Great. Okay, we've got what we need. Thank you all so much. We'll see you back in around 15 minutes from now. Thank you very much.
Distinguished representative, before we start back, I would like to ask your help. There is a time lag when you push the button to speak. Please wait until you see that the light is green and the camera is on you before speaking, so the interpreter can translate accordingly. We now move on the item 7, distinguished representative. The report of the regional director documents WPR/RC 73/2 over the work of WHO in the Western Pacific region during the period 1st July 2021 to 30 June 2022. In the absence of the Regional Director, Dr. Susanna Chakap, Deputy Director General and Officer in Charge, VPRO, the Director Program Management, Dr. Corinne Capuano, and the directors will together present the Regional Director's report, including a regional update on COVID-19. It is now my great pleasure to invite Dr. Chakap and WHO senior management in the region to address the committee. Dr. Chakap, the floor is yours.
Thank you very much. Person, honorable ministers, representatives from member states and partner agencies, Director General, ladies and gentlemen. Welcome again to the 73rd session of the Regional Committee for the Western Pacific. We are pleased to see all of you here, both in person and online. Congratulations to the incoming chair, vice chair, and rapporteurs, and thank you for taking on this important role. As the Director General attaches great importance to the proper functioning of the Western Pacific region, as we discussed this in the morning, in the absence of the Regional Director, he asked me to support the region as officer in charge. In my short time here, I have had the privilege of meeting many of you and colleagues of the office and learn more about the exceptional work that WHO and its member states are doing across this region. Let me use this opportunity to congratulate you all on your achievements, which are really impressive. The report in front of you summarizes the work of WHO in the Western Pacific region from 1st July 2021 to 20th of June 2022. It describes how the region continued to respond to COVID-19 by driving forward the shared vision for the future in its third year. As you well know, the vision for the future puts forward the essential concept of acting today to address the health challenges of tomorrow. Nothing could have made it more clear how important and valid this approach is than the COVID-19 pandemic, a health challenge that came all too soon. For the future vision is directly aligned with the Director General's global vision for the next 5 years to accelerate health. The central thesis is that countries can accelerate health, the SDG and the Triple Billion progress, and that WHO, alongside with partners, can help them to do so. WHO has outlined priorities to focus our work going forward to promote, provide, and protect health through a more integrated approach to the triple billion, making a paradigm shift to addressing the root causes of diseases for healthier populations, reorienting health systems towards primary health care, and making them more resilient as the foundation of universal health coverage, and strengthening health emergency preparedness and response systems and tools. The emphasis will be on primary health care, which unites them, and to power, partner, and perform for health, harnessing the power of science, research, innovation, data, delivery, and digital technologies as critical enablers, and strengthening WHO as the leading and directing authority on global health, focusing more on supporting countries for even more impact and results. You heard about this all from the Director General in his speech. All this is captured in the GPW 13 extension to accelerate progress and in the corresponding program budget 24-25. In 2023, we use the 30 countries platform to take this forward while expanding it to all the countries in 24-25. Under this vision, the region has made impressive achievements in the past year. COVID-19 vaccines were rapidly rolled out, with all countries and areas having now introduced additional and booster doses. We have redesigned healthcare pathways to prepare them for the future pandemic. At the same time, the region has also responded to and prepared for other public health emergencies like the volcanic eruption and tsunami in Tonga in January. And as the DG mentioned in his address, the impressive efforts of Vanuatu have led to its elimination of trachoma as a public health problem, and Singapore has eliminated rubella. Congratulations to both member states. Much has been achieved, but in addition to the important work supporting member states, I have also been impressed by the efforts of our workforce in the region. A lot has been done and achieved to strengthen and improve the workplace culture, but more has to come. I have witnessed a real and sincere commitment from both management and the broader workforce to working on the 3 key areas that were identified by colleagues in February: strengthening the existing systems for reporting and responding to abuse, harassment, and other inappropriate behaviors in the workplace, streamlining and improving our internal processes, and building a more positive, respectful, and inclusive workplace culture. Good progress has been made, but a lot of work remains that requires strong leadership and efforts to achieve the target as agreed at the beginning of the journey. Later this week, we will hear more about this. But for now, to tell you more about this report and the work of the region, I am pleased to hand over to the Director of Program Management, Dr. Corinne Capuano, and the Technical Directors team to continue to present to you the report of the Regional Director. We are working together as a good team. Over to you, Corinne.
Thank you, DDG and OIC WIPRO, Chairperson, delegates, ladies and gentlemen. It is a pleasure to see so many of you here this year and to welcome back many of you to Manila after so long. Last year, in response to the COVID-19 situation, we held our first hybrid regional committee meeting in Himeji, Japan. This year, we have more of you here in person, and it is great to finally be reacquainted. But we are also pleased to be able to continue the hybrid model. It enables more delegates and partners to participate from across the region, making our regional committee stronger and more inclusive. It is just one of the many lessons we have identified throughout the pandemic, and we continue to adapt and improve. Delegates, the report before you highlights how WHO in the region has been responding to COVID-19 while continuing to drive forward our shared vision for the future. It tells how we have built on our culture of learning and improving, and it describes the significant work we have undertaken to improve our workplace culture since we met last year. The world and the Western Pacific region look different to where we were this time last year. More borders are open, more people are vaccinated, and thankfully, less people are dying from COVID-19. In this region, we have fared relatively well. Our collective investment and effort by you, our member states, by leaders across the region, by partners, by communities, and by individuals has paid off. SARS-CoV-2 will remain with us, and for countries moving towards a more sustained approach of its management, we provided a framework based on 5 key tools that they can use in their own context. Ladies and gentlemen, I am pleased to hand over to Dr. Babatunde Olowokure, our Regional Emergency Director, to provide an update on the status of COVID-19 and tell you more about our work in responding to the pandemic and other health emergencies. Over to you, Babatunde.
Thank you, Dr. Capuano. Since 2016, countries and areas in the Western Pacific region, in collaboration with WHO and partners, have strengthened their health security systems while responding to a variety of public health emergencies. They have been guided by the APSED Pacific Strategy for Emerging Diseases and Public Health Emergencies, otherwise known as APSED, and the recommendations of the APSED Technical Advisory Group. The APSED strategic framework, based on our region's previous experiences and lessons, enabled member states to strengthen their core public health capacities and implement the revised International Health Regulations 2005. The COVID-19 pandemic is the latest major public health event to impact on health security in our region and challenge our investments in preparedness. As of the time of this report, WIPRO had reported more than 90.8 million cases of COVID-19 and 270,000 deaths. This region, home to 1.9 billion people, a quarter of the world's population, only accounted for 3.8% of global deaths and 11.8% of total cases reported worldwide. While it is tragic that so many lives have been lost and families have been affected, the relatively low numbers seen in our region have been attributed to a number of factors. These include our previous experience with SARS, the urgency with which our member states reacted to COVID-19, their general adoption of suppression strategies, the implementation of APSED, national coordinated multi-sectoral approaches, regional coordination, and regional solidarity. Across the Western Pacific, we are now seeing a declining trend in cases. While this may be due to a number of reasons, including reduced testing, indicators of severity such as admissions to intensive care units and deaths from COVID-19 are also generally decreasing. However, we have also seen that some countries are now reporting an increase in cases. This may potentially be associated with new, more transmissible subvariants. The continued emergence of such subvariants emphasizes that we must remain vigilant and continue to be prepared and ready to respond to new surges. The pandemic is not yet over. This year was another challenging year in our response to COVID-19. We saw large surges due to the Delta and Omicron variants, and several Pacific Island countries and areas experienced local transmission of SARS-CoV-2 for the first time. We continued our efforts to connect member states, share information and experiences, and learn together so that we are better prepared for the future. In the third year of the pandemic, taking into consideration country context, WIPRO has supported countries to shift to sustainable management of COVID-19 using 5 complementary tools. These are vaccines, public health and social measures, healthcare capacity, as well as healthcare pathways, early detection and response, especially using genomic surveillance, and international border measures. At the same time as responding to COVID-19, we have been preparing for and responding to other health emergencies. All represent a constant and growing threat to the region and emphasize the need to continually learn and improve in order for our region to be the healthiest and safest. For example, in December 2021, we responded to Super Typhoon Rai in the Philippines, and a month later, we were faced with the devastating volcanic eruption and tsunami in Tonga. Food safety-related events continue to be reported through the joint FAO-WHO International Food Safety Authorities Network, otherwise known as InfoSan. Additionally, monkeypox cases were diagnosed for the first time in our region in May 2022, and during the reporting period, dengue cases have increased across the region. Sporadic cases of avian influenza infections in humans continue to occur, and influenza cases are already exceeding pre-pandemic levels in some countries. Finally, the emergence of COVID-19 has highlighted the challenges to traditional food markets in the region, as well as the utility of the One Health approach for issues related to food safety and zoonotic diseases.
Thank you very much, Babatunde. Where we are today in the pandemic is a result of the actions we took yesterday. In particular, the region's investment over the years in emergency preparedness through the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies, or APSED, has enabled the region to do relatively well. In the same vein, we continue to think about how we can best invest and prepare today for the other health challenges of tomorrow. As the pandemic continues, we also face many other health issues. Across 2021 and 2022, WHO in the Western Pacific continued to focus on how we could drive forward for the future. To tell you more about our work in these areas, I'm pleased to hand over to our technical directors. Huang, the floor is yours.
Thank you, Dr. Capuano. Throughout the pandemic, the Division of Programs for Disease Control has focused on maintaining essential services by adopting new approaches and innovations. The immense efforts of getting COVID-19 vaccine to the 5 corners of the region, such as the outer island in Tonga, and the people who need the most is the symbolic of the division's work. By late June 2022, 31 of 37 countries and areas in the region had vaccinated at least 90% of healthcare workers with all recommended doses. 24 had vaccinated 90% of their older populations, and 18 have achieved or surpassed 80% vaccination coverage of their entire eligible population. This work stretched far and wide, making an enormous difference for people like this woman from a highland community in Vietnam. Reaching the unreached remains at the heart of all we do. We are pleased to present the draft regional framework this week, which focuses on transforming health systems to be integrated, comprehensive, people-centered, and built on strong primary health care to reach everyone, everywhere. Across the region, there have been reasons to celebrate. Amid the pandemic, 8 countries and areas maintain measles elimination. 6 maintain rubella elimination. Singapore achieved rubella elimination and Vanuatu eliminated trachoma. The WHO Mekong Malaria Elimination Program contributed to 39% reduction of malaria cases in Cambodia, Laos, and Vietnam. Yet, there is more to do. Mental health is growing concern, especially throughout the pandemic, when more than 200 million people across the region have been affected by mental health issues and substance use disorders. And non-communicable diseases continue to ravage the region, accounting for nearly 87% of all deaths. The draft regional framework presented this week will go a long way in achieving impact in these areas.
For the future underscores the need for new ways of working or operational shifts to meet our ambitious agenda. The Data Strategy and Innovation Group work to use these operational shifts to support member states in creating a healthy future and promoting health as an essential enabler of sustainable development. Key to this effort are the Technical Advisory Group on Universal Health Coverage and TAG Alliance. At the November 2021 meeting, the UH's TAG laid out a shared vision of a healthier new future based on strong public health capacity for sustained management of the COVID-19 and beyond, people-centered lifelong engagement and participatory primary health care, and integrated planning and delivery of data, disease control program, and health systems. We facilitated health future strategic dialogue to support foresight-based planning and agenda setting. This helped Philippines' efforts to achieve UHC by 2030 and Mongolia's vision for transforming its health system by 2050. We provide technical advice on harnessing innovation. The first global open call for the Innovation Challenge attracted more than 400 submissions from 48 countries. Additionally, we supported the development of the Innovation Repository, a database on government-led health innovation, which was launched at the Second Innovation Forum in April 2022. We also developed a tool to systematically identify health information workforce competency needs and supported Lao People's Democratic Republic and Papua New Guinea in building these capacities in sustainable way. These actions are enabling us to better support member states to picture the future they desire and forge the pathway to get there.
As Dr. Fo mentioned, while COVID-19 has been at the front of everybody's mind, the burden of non-communicable diseases and injuries remains one of the greatest threats to the health of our region. We look forward to the discussion on the regional action framework later this week. The Division of Healthy Environments and Population has supported member states to address the crippling double burden of malnutrition, that is obesity and then diet-related NCDs, alongside undernutrition, through implementing the regional action framework on protecting children from the harmful impact of food marketing. The WHO Tobacco-Free Initiative has engaged member states in policy dialogue, implementation of smoke-free laws and policies, and strategy to strengthen cessation services. A multi-country consultation was held to inform smoke-free policy legislation and implementation. We have worked with member states to tackle the challenges of new and emerging tobacco and nicotine products using available data and in local context. We have seen an impressive progress in aging, a key area identified for the future. The division has consolidated evidence and identified age-friendly policy options. We supported Cambodia to develop a national training curriculum for primary healthcare workers, leading to a plan to reorient the healthcare system to improve community-based integrated care. We also worked with the Philippines to develop national policies and programs on healthy and productive aging, while Brunei, Cambodia, and Palau held consultations to develop national policies on aging. Lastly, the division has supported member states to combat the health impacts of climate changes and environmental degradation, building resilient, sustainable healthcare facilities. We supported Vietnam to develop an air quality index to disseminate health advisories during the peak of air pollution to the public.
The Division of Health Systems and Services supports the efforts of member states to ensure robust health systems to expand universal health coverage. This is essential for better health for all and the achievement of the thematic priorities for the future. Last year, the Regional Committee discussed the importance of primary health care for the future of health in our region, to address the staggering burden of non-communicable diseases and to reach the unreached. Phnom Health Center in Kampot, Cambodia, pictured here in March 2022, is a good example of primary health care that promotes good health, not just treats the sick. It provides support for hypertension, diabetes, vaccination, healthier lifestyle counseling, and many other services to help the community stay healthy. This year, we have focused on transforming primary health care. We have developed, in consultation with member states and partners, a draft regional framework on the future of primary health care, which we look forward to discussing later this week. We have begun working with member states such as Mongolia and Cambodia with policy dialogue and technical assistance to strengthen and transform primary health care. 2 years ago, the Regional Committee endorsed the action framework for safe and affordable surgery. We have supported its implementation. In Cambodia, Fiji, and Mongolia, we supported safe surgery planning, including a focus on strengthening sterilization to improve safety of surgical procedures. In Fiji, Mongolia, and Vietnam, we supported surgical reviews, which identified essential surgical equipment and sterilization as priority areas to improve surgical safety.
The Division of Pacific Technical Support, based in Suva, Fiji, coordinates and provides timely, tailored support to 21 Pacific Island countries and areas. For many of these member states, 2022 was the first time they experienced local transmission of COVID-19. Fortunately, work that began nearly 2 decades ago with the first iteration of what became EPCED-3 helped prepare Pacific Island countries and areas for the pandemic and other recent emergencies, along with the work on broader health system strengthening. The Pacific Joint Incident Management Team, led by WHO, continued to play a pivotal role in the Pacific's response to the pandemic. For example, the work of partners ensured that more than 1.3 million doses of COVID vaccines were provided to some of the region's most remote places. Increased investment in national emergency medical teams has also paid off, as they've supported responses to climate-related disasters, volcanic eruptions, and infectious disease outbreaks. Of course, the Pacific continues to face other health challenges and threats. NCDs, climate change and emergencies, and we've continued to work with Pacific countries on these and other priorities right through the pandemic. To further guide this work, the 14th Pacific Health Ministers meeting discussed how to accelerate action on NCDs, put health at the centre of climate change discussions, and leverage the COVID-19 response and increased focus on health to strengthen health systems.
Thank you, Mark, Martin, Hiro, Kidong, and Huang. Delegates, these provide just a small snapshot of the work that we have done hand in hand with you, our member states and partners this year, as we continue to drive forward for the future, while also responding to COVID-19. And while we continue to address these pressing health challenges across the region, we have also spent time reflecting on how we can function better internally in order to serve you better. Continuing our tradition of learning and improving, in January 2022, we began a journey of strengthening our workplace culture, staff well-being, and organizational efficiency. As mentioned by DDG and OIC WIPRO, we have focused on 3 key areas: strengthening and expanding systems for reporting and responding to complaints about inappropriate conduct, simplifying and improving internal processes, and working towards reshaping the region's workplace culture to be one that we can all be proud of. Key to this has been the Pacific notion of Talanoa, using an inclusive, participatory, and transparent dialogue. Through surveys, group discussions, town halls, working groups, and regular emails updates, we have engaged in a meaningful conversation and are making positive, lasting change. For example, we now have a new full-time ombudsperson and a staff member working on the prevention and response to sexual exploitation, abuse, and harassment. It has not been an easy task, and it is far from over. But the region and its workforce have shown their clear commitment and determination to get this right. You will hear more about this work later in the week under agenda item 16.3 on WHO reform. Honorable ministers, distinguished delegates, it has been another tough year for many reasons, but our determination to make this region the healthiest and safest has not changed. I would like to recognize the hard work of our workforce during this challenging time and their dedication to creating impact for health, but also for making our workplace better. And on behalf of the Secretariat, I would like to thank you, our member states and our partners, for your continuing support. We look forward to continuing to work together with you for the future. Thank you, Mr. Chair.
Thank you very much, Dr. Chakap, Dr. Kapuano, Director. We now go to distinguished representatives for their comments on this agenda item and the Director General address item 6. Please indicate your wish to speak by clicking the big button on your microphone if you are in the plenary, or by using the raise hand function on Zoom.
Honorable Bin Fein, Pumalai Sit, Minister of Health, Lao, PDO, and Chairperson of the 7th Third World Health Regional Committee meeting. Honorable Minister, Representative, and members. Honorable Dr. Tedros, Director General of World Organization, Honorable Suzanne, Deputy Director General of World Organization and Officer in Charge for Western Pacific Region, distinguished guests, ladies and gentlemen. It is my great honor and privilege to be here attending the 73rd session of the World Health Regional Committee meeting for the Western Pacific. I would like to express my deep appreciation, heartfelt thanks for the warm welcome and hospitality extended by Dr. Susan Sakop, officer in charge, and the government of the Philippines have been provided to my delegation during our stay in Manila of the Philippines. Cambodia has successfully managed the COVID-19 preparedness and response. In connection with this, I would like to convey the highest appreciation of Samdech Akak Mahasena Padai Dacho Hun Sen, Prime Minister of the Kingdom of Cambodia, to the World Health Organization and other member states for providing timely and effective support to Cambodia and responding COVID-19 pandemic and maintaining the provision of essential health services to Cambodian people that enable Cambodia to reopen the country and socio-economic activities in November last year. Cambodia has noted a significant achievement in health over the past year in the region with the assistance of the World Organization team working together at country and at regional level. Cambodia continues to apply the future's vision lesson learned from stock taking during the last regional committee meeting. The vision paper remains relevant to guide our work. Like many other countries, the virus is still circulating in Cambodia. We are making every effort to suppress transmission of the virus with the implementation of 3 does and 3 don'ts. We are continuously assessing and adjust our COVID-19 response strategy in order to learn and adapt how to live with the virus, while allowing safe and sustainable reopening of the society and the economy. According to Cambodia Ad hoc Committee for COVID-19 Vaccination Report, as of 23rd October 2022, COVID-19 vaccination across the country have reached over 95% of the total population of Cambodia, and over 64% received the booster dose. I would like to share 4 crucial factors that have contributed so far to the successful response. First, strong leadership and proactive Samdech Akak Mahasena Padai Dacho Hun Sen, Prime Minister of the Kingdom of Cambodia, to involve the whole of government and society in fighting against COVID-19. Second, invest in health security and health system. Third, public participation, communities, and the people engagement. And lastly, solidarity and partnership. Excellency, distinguished guests, ladies and gentlemen, Cambodia has made remarkable progress in improving health of the population over the past decade. According to the General Population Census 2019 and Cambodia Demographic Health Survey 2021-2022, life expectancy for both sex to 76 years in 2019 from 67.5 years in 2012, while maternal neonatal under 5 mortality have reduced more than half between 2000 and 2021. A strong official disease control program performance has resulted in remarkable reduction of morbidity and mortality of HIV/AIDS, malaria, and tuberculosis. Even so, regaining healthcare utilization addressing as array of NCDs, strengthening resilient health security, finishing agenda for maternal and child health, and infectious disease remain priority for investment in health in the year to come. In this regard, our 4th National Health Strategic Plan 2023 will focus on the 5 strategic shifts. 1, refocus on primary health care and financial, a key foundation for universal health coverage. Second, from a creative and a resilient health system, reactive to a resilient health system. Third, from targeted to universal coverage and financial risk to financial and social protections. Fourth, from volume to values-based healthcare, improving qualities. And fifth, from provider to people-centered care, harnessing innovations. Finally, I would like to highlight that ending COVID-19 pandemic is our common goal and our collective effort, along with our solidarities and cooperation are necessary. Cambodia continues to work closely with member states, world organizations, and global partners toward healthier and safer world. Cambodia fully supports WHO assistance and coordination and the global response to COVID-19. We look forward to advancing our journey toward a better future for the population and the Western Pacific region. I thank you.
Thank you, Minister. May I call on Japan to be followed by Singapore. The floor is yours.
Thank you, Chair. On behalf of Minister Katsunobu Kato, I would like to deliver his statement. It is a great pleasure for me to address the ministers and the distinguished guests from the Western Pacific region shortly after my third appointment as Minister of Health, Labor and Welfare in August. First of all, I would like to thank all of you who traveled to Himeji or participated virtually for the regional committee meeting held in Japan last year. Over the past year, the world has experienced not only the COVID-19 pandemic, but also the spread of monkeypox. In further pushed member states to work together to strengthen prevention and response to zoonotic diseases. I learned through some studies that the Western Pacific region has responded more effectively to COVID-19 than other regions, and I would like to express my sincere gratitude to the WHO staff in the region and to the health workers in each country for their dedicated work on the front line. With regard to international efforts to establish regulations against the infectious diseases, Japan is committed to making two contributions in particular. First, as a bureau member of the Intergovernmental Negotiating Body, INB, on the WHO Instrument on Pandemic Preparedness and Response, Japan is going to seek input from the whole region, reaching out to small island states. Second, as a member state, we are going to actively participate in discussions at the INB, as well as the working group on amendments to the international health regulation. Let's work hard for the effective operation of these two instruments to prevent devastating consequences of pandemics in the future. Last but not least, the importance of universal health coverage has been recognized once again, not only in terms of supporting people's lives and livelihoods in normal times, but also of responding to the crisis times such as pandemic. We will continue to contribute to the Western Pacific region and the world to achieve more resilient, more equitable, and more sustainable UHC, including through the G7 Health Ministers meeting and the UN High-level meeting on UHC scheduled next year. Regarding current organizational operation of the Western Pacific Regional Office, we are encouraged by the fact that many member states are collaborating to ensure the region's own decision-making, and thus to effectively address global health challenges as a region. Japan will continue to cooperate with all the member states to the fullest extent in order to protect the health of the Western Pacific region. Thank you for your kind attention.
Thank you, Japan. Next, Singapore, the floor is yours. To be followed by the China.
Thank you, Chair. Amidst these trying times, it is certainly good to be back in Manila to attend the RCM again and to see familiar faces and make new acquaintances. Singapore thanks the officer in charge, the RD, EPM, and the entire Wipro team for the report. Let me contribute 3 reflections. First, COVID-19 continues to be a threat. The global COVID-19 situation has improved since the pandemic began, and the world is in a better position to handle COVID-19. But global attention is shifting away from COVID-19, even as the Omicron XBB variant reminds us of the ongoing evolution of the virus. We need to remain vigilant to respond as a region and as a global community. Second, other health challenges persist in our region. These include aging, non-communicable diseases, nutrition, and tobacco control. The health impacts of climate change also deserve a special mention. In this regard, we acknowledge and appreciate the support that Wipro has given to member states, ranging from advocacy and resource development to technical expertise and guidance documents. Third, for member states to achieve our outcomes in improving the health of our region, it would not have been possible without your unwavering professionalism and dedication. Singapore sincerely thanks all Wipro staff for the hard work in what has been a very challenging 12 months. This too shall pass, and we will continue to press on towards making the Western Pacific the world's healthiest and safest region. Thank you, Mr. Chair.
Thank you, Singapore. Next is China, and to be followed by the Brunei. China, the floor is yours.
Thank you, Mr. Chair. China thanks the reports presented by the Director General and also the Regional Director, which comprehensively summarize the health-related progress and unmet challenges in the region and in the world. Chinese delegation appreciates these reports. While the coronavirus pandemic continues to drag on, the infection and mortality rate in the region have been continuously kept at a relatively low level. China has prioritized its people and people's health and life. We unswervingly have upheld dynamic COVID-0 and scientifically controlled pandemic in a targeted manner, maximized our protection of people's life, safety, and health, and taken a coordinated step to balance economic, social development, and pandemic prevention control. Chinese population is over 70% of the region's population. China's prevention control achievements have contributed actively to the outcome of pandemic control in the region. As the regional director's report has pointed out, we need to practice a country-centered purpose. The principle guiding the relation coordination among the headquarters, region, and country offices. China welcomes the country-centered approach. China has taken note of WHO's recent reform process on the sustainable financing, and we appreciate the organization's formal communication with member states on key work and program budgets. China calls on all parties to further improve flexibility of voluntary contribution so that the organization can focus on key and urgent public health issues and formulate international health agenda in a professional and impartial manner. Only by so doing can we realize the 2030 health-related sustainable development agenda at an early date. At the same time, we encourage the organization to continuously improve its self-managerial and governance efficiency and boost transparency and inclusiveness. On the shortly concluded 20th National Congress of the CPC, President Xi Jinping pointed out that China will continue to give strategic priority to the development of healthy China and the safeguards for people's health. We will provide policy support in family planning and actively implement national strategy in response to aging. We will promote the innovation and development of traditional Chinese medicine. We will advance public health system by strengthening major pandemic prevention control treatment system and emergency response capacity building so as to effectively curb the spreading of major infectious diseases. And all these are in high alignment with the work focus of the region and the headquarters of the organization. China will be a staunch supporter of the core leadership and coordinative role of the organization. We will continue to participate in the reform process of the organization. We will collaborate with the regional members in solidarity to realize the vision enshrined in the white paper for the future and promote the 2030 health-related agenda and for the building of a community of health for all. I thank you.
Thank you, China. Next, may I call on Brunei and to be followed by New Zealand. Brunei, the floor is yours.
Thank you. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and a very good afternoon. Chair, Director General, Interim Regional Director, Honorable Ministers, Excellencies, distinguished guests, ladies and gentlemen. Brunei Darussalam welcomes the report of the Regional Director and congratulates the Western Pacific Regional Office for the comprehensive work done at many different levels over the last year in driving forward the vision for the future, even when the world is still battling with COVID-19 surges. We also would like to take this opportunity to thank Dr. Susanna Jacob, the Deputy General, as the officer in charge for holding the fort and ensuring the work of FIPRO continues. We are committed to continue in ensuring the implementation of Regional Action Agenda for the achievement of universal health coverage and sustainable development goals. Brunei Darussalam's partnership with Regional Office continues to strengthen, and our joint efforts over the years have seen progress in areas including strengthening our IHR capacities, access to vaccines and other essential medicines, health communication, prevention and control of non-communicable diseases, and healthy aging. Preventing and controlling non-communicable diseases remains a national priority for us in Brunei Darussalam. I'm pleased to inform that we have recently launched our second Brunei Darussalam multi-sectoral action plan for the prevention and control of NCDs 2021-2025, as well as the second national physical activity guidelines for Brunei, which are more comprehensive. The COVID-19 pandemic serves as an opportunity for Brunei Darussalam to adopt digital health tools. BruHealth, a digital application developed initially as a contact tracing tool, has been developed further and integrated with the existing centralized national e-health record system, the BruHealth Information Management System Database, or BruHIMS, which has a coverage of more than 95% of Brunei's resident population. The strong data integration allows for a continuum of care, from the clinician access backend, that is BruHIMS, to the user access front end, that is BruHealth, and avoids fragmentation of the digital health infrastructure in the country. The government of Brunei Darussalam is continuously working to enhance BruHealth's functions in health promotion and health service access. In building a sustainable and resilient healthcare system in the face of challenge, including emerging infectious diseases, non-communicable diseases, aging populations, and growing healthcare demand, we look forward to continue our partnership and collaboration with WHO and other member states and other relevant dialogue partners in achieving better health of the people of the region. Thank you.
Thank you, Brunei. Before I invite New Zealand to take the floor, may I remind anyone who wishes to speak to press the button on their microphone. The next, may I call on New Zealand to be followed by Philippines. The New Zealand, the floor is yours.
Tēnā koutou katoa and warm Pacific greetings, Chair, Director General, Dr. Jakob, fellow ministers and colleagues. It's a pleasure to reconnect kanohi te kanohi or face-to-face at this important regional committee meeting, the first Aotearoa New Zealand has attended in person since the onset of the COVID-19 pandemic. Whether delegates are present in Manila or joining this meeting virtually, our engagement here reiterates our commitment to work collaboratively together to address the diverse health challenges facing our region and make it the safest and healthiest region as envisioned and for the future. Since we met last year, Aotearoa New Zealand has experienced significant waves of COVID-19 infection, which have seriously strained our health system and healthcare workers. We know many of our fellow members states continue to face similar challenges. Like all challenges, it is one that shapes us and will influence the way we work in future, ultimately in positive ways. As we emerge from the pandemic, the same health issues the Western Pacific faced beforehand continue to test us and call for our action, perhaps with more urgency. This includes the prevailing inequities within countries that impact on our most vulnerable and marginalized populations. We must learn from our experience of the pandemic, first and foremost, the truth that not all populations, both within and between countries, have borne the burden of COVID-19 equally. This was the case before the pandemic. In Aotearoa New Zealand, people have differences in health that are not only avoidable but unfair and unjust. Māori, our indigenous people, and Pacific peoples are more likely to experience disproportionate rates of health risk and shorter life expectancy compared with the general population. How can we address this? We need robust, people-centered healthcare systems built on platforms of primary healthcare co-designed to reach all populations. We have to eliminate systemic racism, remove barriers, and tackle inequities head-on. For Aotearoa New Zealand's part, our recent health and disability reform has enabled us to learn from our past and set us on the path to better address the health and disability disparities within our country that undermine individual and collective socioeconomic well-being. Acknowledging these persistent health inequities, the reforms will enhance Māori decision-making, ensure greater influence across the system, supporting Māori to take control of their own health and well-being. Similarly, we have mandated Aotearoa New Zealand's first women's health and Pacific health strategies as part of our primary health system legislation. These strategies will reflect the social, cultural, and economic circumstances that influence health. Their development will rely on significant stakeholder engagement. For example, the Pacific Health Strategy will be informed by our strong and sustainable relationship with Pacific healthcare providers and community whānau, using language that they can better understand challenges. Consultation will also underpin our women's health strategy. We seek to learn more about gender differences in health from our communities. Colleagues, as a Pacific nation with a deep history with our partners in the sub-region, Aotearoa New Zealand remains committed to supporting Pacific Island countries to achieve resilient health systems that can withstand health security threats and deliver sustainable and inclusive health services. Collaborating to face the remaining challenges around sexual and reproductive health and rights is a priority for our work in the Pacific. In particular, the need for improved access to these services for remote and undeserved communities. Leading to significant multi-country investments in the Pacific over the next 5 years, with a focus on family planning and the overall aim of supporting Pacific people's full realization of their sexual and reproductive health and rights. We are proud to work with ministries of health, as well as WHO, UNICEF, the United Nations, Population Fund, and International Planned Parenthood to to support our partners' ambitions and strategies and achieve progress in these areas. Chair, as we begin the week's work, I wish to reiterate that Aotearoa New Zealand looks forward to listening and learning from each of you all over the course of this regional committee meeting. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you.
Thank you, New Zealand. Today's session will be stopped at 5. May I call on the Philippines as the last speaker for today. The floor is yours.
Thank you, Mr. Chair. Our delegation from the Philippines welcomes the Director General of WHO and all of the member states here in our country. We are honored and privileged to have you in our country for this regional committee meeting. Indeed, these are unprecedented times for the Western Pacific, but we have unwavering confidence in our regional capacity to cohesively address the challenges we are currently experiencing, particularly on the operations of the WHO Regional Office in the midst of continued threats to health security. We all share the common goal of protecting the centrality of an efficient and effective WHO Regional Office in supporting and consolidating member state actions to address public health threats such as COVID-19 and the monkeypox outbreak. We thank DDG HACAB and the WHO WIPRO team for sharing the regional director's report. The Philippines affirms for the future's vision's continued relevance and utility to regional and national priorities. It remains pertinent despite changes brought about by the pandemic and the new normal. The shifting of the burden of disease and the transition from vertical disease programs to life goal responses. The COVID-19 pandemic reinforces the need to accelerate for the future and provides unique opportunities such as improved digital innovations, strengthened healthcare and communication channels, and prioritization of health issues among communities. We appreciate the report's recognition of how the Philippines has demonstrated significant progress in implementing the For the Future vision in terms of health security and the AMR, the non-communicable diseases, and aging, including mental health legislations, climate change resilient and environmentally friendly sustainable healthcare facilities, health future strategic dialogues, and indicator framework for UHC performance monitoring. We also note the WHO, UNICEF, and US CDC post-introduction vaccine evaluation for the Philippines in 2022, which highlighted how the COVID-19 vaccine response served as an impetus to strengthen routine immunization by capitalizing on the gains made. Thus, we commit to further strengthen multi-sectoral coordination, increasing financing, and improving cold chain infrastructure, logistics, and supply chain systems. We also look forward to doubling our efforts on the last mile approaches in the region in order to reach more vulnerable groups and people living in remote outer islands for vaccination. We support the global health security initiatives, including efforts to amend the IHR. We appreciate the Secretariat's assistance in developing the National Action Plan for Health Security, as well as the continued collaboration in strengthening border surveillance and control at all ports of entry, the Interagency Committee for AMR, and the increasing capacities on coordination for crisis management during food safety emergencies. Most importantly, we are looking forward to discussions on how the For the Future vision will guide the WHO's country cooperation strategy with the Philippines for 2023 to 2028 to reflect the new administration's major priorities and strategic thrust of enabling people to be healthy, protecting people from health risk, caring for the people's health and wellness, and strengthening health institutions and workforces. Thank you very much, Mr. Chair.
Thank you, Philippines. We will now suspend this item and we resume consideration of the items tomorrow. I still have on the list 8 countries. We have now reached to the end of today's session. We will reconvene tomorrow at 9 a.m. in the morning, Manila time. This evening, there will be the reception for delegates hosted by the Secretariat. I would like to invite the Director of Administration and Finance, Mr. Kopsa, to remind us of the details. The special session will now continue in this room. Thank you very much.
Thank you very much, Chair. And as the Chair has said, we'll have a resumption of the special session. It'll begin directly after this session to consider the draft decision. For those of you online who would like to join, I would ask that you please switch over to the special session Zoom link right after this session. And I will also ask all the WIPRO Secretariat who are not directly supporting the special session to please depart the room after the suspension this afternoon. And at 5:15, there'll be a first meeting of the rapporteurs tonight on the second floor of this hotel in the Amethyst Room to discuss the work of the group for the week. And then, as the Chair has mentioned, at 1800, 6 p.m., the region will host a reception for all participants who are physically here on the 27th floor. Please remember to wear your conference badge for access to the reception. And the final reminder is, as said by the Chair, tomorrow's session will begin at 9 a.m. Thank you, Chair.
Thank you, Koswa. So today's session is closed now. Thank you very much.